Thank you to those just jumping on now. We'll be getting started in just a minute with our conversation. An introduction to Dr. Brandy Hood. Okay, we're just a minute past the top of the hour. So now is probably the most appropriate time to get started. First, I want you to know who you're hearing from here first. My name is Nick Campbell. I work with Medtronic, the company that developed and implements the InterStim therapy. Dr. Hood is a partner of ours at Urology Associates here in Nashville. And I know, I appreciate everyone getting on. The weather is quite conducive for a virtual event. Hopefully everyone is safe out there, and the weather kind of moved through pretty quickly. But wanted to take a minute here to introduce you to Dr. Brandy Hood. Dr. Hood is a native of Flowood, Mississippi, and she completed her undergraduate at Mississippi State University. She then attended University of Mississippi School of Medicine in Jackson. She completed her urology residency at the Wake Forest School of Medicine in Winston-Salem, North Carolina in the summer of 2018. She joined Urology Associates. She's a board-certified urologist offering comprehensive urologic care with an interest in incontinence, pelvic floor disorders, and sexual health. Outside of work, Dr. Hood and her family love camping and hiking and spending many weekends and hours cycling on the greenways of Nashville. And in her spare time, she can be found kayaking on the Cumberland River, throwing a new piece of pottery, or reading something dirty about wizards, fairies, or dragons. Dr. Hood is a wonderful physician. She's passionate about the way she treats her patients. We at Medtronic get to see that firsthand, and she's a phenomenal resource for all things pelvic floor and bladder related. So now I'm going to turn it over to Dr. Hood and let her tell a little bit about herself and go through the presentation. Dr. Hood, take it away.
All right, thank you, Nick, and thank you everybody for joining. I'm from Mississippi. I moved here to Nashville in 2018, as I said. I work at Urology Associates, and I see a lot of patients with incontinence problems. So I really enjoy talking about it, getting the word out so that people know that they have options. Bladder control is a common problem, and it may be the type of leakage where, you are active and you move or jump, or, people tell me they can't jump on the trampoline with their kids and they leak. Other type of leakage is less predictable, and it sort of occurs when you get the urge to get to the bathroom, you can't get there in time. And so it can really affect quality of life. It can affect how you schedule events. Events are scheduled around how close you are to a bathroom, because you never know if you're going to have to get there really quickly. As I said, it's pretty common. It's a pretty common issue. Unfortunately, more than 50% of people don't want to talk about it, either because they're embarrassed or because they've just been told that's a normal part of aging. But although it's common, it's not a normal part of aging, and there are a lot of options available. So tonight we're going to talk about, how bladder control works, what is sort of the algorithm, types of leakage, types of treatment options, and then specifically about some of the treatment options for overactive bladder type leakage, which we'll kind of get into. So as I said, incontinence is a very common issue. 1 in 6 Americans have difficulty with bladder control. That's 43 million adults in America. And if you think about, some comparison, 12 million adults have glasses like me, 30 million adults with diabetes. These are very common, well-known problems, and incontinence affects even more people. But unfortunately, a lot of those people are going without treatment. So, urinary incontinence, as I said, it isn't a common part of aging, but it's not a normal thing. It's not something you have to just live with. If you have frequent accidents, as I said, you kind of have to schedule your days around where the bathroom is, because you have to get there pretty quickly. You have to wear pads. These are things that we can work on and things that we can treat for you. So if you're finding that paragraph very familiar, then keep listening. So how does bladder control work? Well, basically, your bladder, your kidneys create urine, sends it down into the bladder. Your bladder is sort of a reservoir, and under normal circumstances, it's a reservoir that can hold quite a bit of urine. When it starts to get to that point where it's feeling full, it sends a signal to the brain that says, "Hey, I'm kind of reaching that point where we're going to need to empty soon." But you should have conscious control. You need the brain is going to think about, is this an appropriate time to use the restroom? And if so, then yes, we're going to tell the bladder it's okay to start emptying. If not, we're going to hold on to it. So when these communications break down, people can have trouble with bladder control, where the bladder, it's telling you it's full when it's really not full. So you're going all the time, or it's sort of bypassing some of that communication. So instead of waiting for you to say, yes, this is an appropriate time to go to the restroom, bladder is almost kind of hypersensitive. When it feels like it's getting to that full point, it just kind of starts squeezing. So you get this urge to really get to the restroom quickly, and you may leak on the way. There are a variety of things that can cause incontinence: daily habits, fluid intake, types of fluid. Certain medications can increase your risk. Reduce physical mobility, which can make it difficult to get to the restroom in a timely manner. Pregnancy, childbirth, radiation, pelvic floor injury. These are all things that sort of affect the strength and the function of the pelvic floor. And sometimes we don't have an exact cause. Sometimes it may be idiopathic, meaning it just sort of happens. We don't have an exact reason to, something to blame it on. So there are a few different types of incontinence. As I said earlier, stress incontinence is that type of incontinence that occurs with activity. If you're jumping, sneezing, or sometimes even just getting up from a seated position, if you have to struggle a little bit to get up or push hard, any kind of activity that pushes or puts pressure on the pelvic floor can cause you to leak. And stress incontinence is more of an anatomy problem, and it has to do with weakness in the support tissues around the urethra. Urinary retention is a situation where the bladder doesn't empty, and it can cause overflow incontinence, meaning you get so full that you leak. And then overactive bladder is, like we said, that's a breakdown in the communication. So, leaking with coughing and sneezing, as I said, is one of those things that does tend to get more common as you age. Pregnancy, childbirth, those are things that can stress the muscles in the pelvic floor. Like I said earlier, a lot of people tell me you can't jump on the trampoline with the kids, or maybe can't go for a run. And so that's a structural problem. Overflow incontinence may occur if you're holding on to too much urine. You may find that you feel really full and you go to the restroom and you never get all the way empty. So there's always a kind of a half full tank, and you may leak because your bladder's never really getting fully empty. And then overactive bladder, as we said, is a communication problem. So, you may find that you are not making it to the restroom because the bladder's already starting to squeeze. You may feel that you are having to go to the bathroom kind of all the time, and that's because your bladder is sending you that signal that you're really full when you're not. And it is also often associated with overactive bladder. You may have overactive bladder and not leak. Some people may have some leakage and not all of the symptoms of overactive bladder. It's sort of a spectrum. A lot of it is treated similarly, though. So as we said before, a lot of people don't talk about it, don't seek evaluation, but for all these different types of incontinence, there are treatment options for a variety of treatment options, ranging from medications to less invasive, more invasive. So, a lot of different things to try. So what is sort of the algorithm? There's generally a pathway that we follow in terms of treating incontinence, overactive bladder. So of course, it starts with the diagnosis, seeing a physician, talking to them about the problem, someone, talking to you about what type of incontinence you have, leading you down the pathway of what the right treatment may be. For a lot of these issues, there are some lifestyle changes, there are medications, and then there are, surgeries, as I said, either little surgery, small procedures, or sometimes a little bit more invasive surgery. So lifestyle, dietary changes. You can talk about what kind of things in the diet affect the bladder. One of the most common bladder irritants is caffeine. So if you're a big coffee drinker or drink a lot of soda, that can affect the bladder. Exercise, some exercises that can strengthen the pelvic floor and help kind of support the pelvic floor or support the bladder and the urethra. And then there are some exercises you can do to try to teach your bladder how to hold on to urine a little bit better, bladder retraining exercises. And sometimes we'll actually send patients to physical therapy to work on bladder retraining, to work on understanding what the pelvic floor is and what it feels like to contract that muscle, because it's not something you think about every day. And sometimes it can be hard to know if you're really contracting the pelvic floor like you think you are. So for some people, those lifestyle changes may be enough. You know, I've definitely had some people tell me they stopped drinking coffee and suddenly their bladder control seems to be a lot better. But a lot of people will end up moving down the pathway to medications. Medications do have some benefit for some people. Unfortunately, a lot of people stop them because the effect wore off or the side effects were problematic. So, you know, it's a daily medication. You have to remember to take it. OAB medicines can often cause dry mouth, constipation, can affect your vision. Some of the older medications, there has been lately some concern over causing some confusion later in life, and some of the newer ones can cause hypertension. So a lot of things to consider. We have to talk about what medication is right for you. Sometimes you may try one or two medications just to make sure, you know, we've tried some of the conservative options. But if medications don't work, then you may move on to more advanced therapies. So there's a couple of different options. So we're going to talk mostly about overactive bladder treatments tonight. Stress incontinence is a little bit different reason or cause, which means a little bit different treatment. So we're going to talk a little bit more about overactive bladder tonight. So one option would be the InterStim system. Another would be this Medtronic neurosystem, which is a version of something called posterior tibial nerve stimulation, and then medications that are injected into the bladder. So we're going to start with the medication, the Botox, which is probably a medication you've heard about, maybe commonly used for wrinkles or muscle spasticity. Basically, it's a medication that decreases the contractility or the ability of a muscle to squeeze, and also has some effects with communications of the nerves in the bladder to the peripheral nerves. So the way it works, the medicine is injected into the bladder muscle through a scope and a small needle. It again is one of those things that can be very effective for some patients, but is not effective for all patients. And it is something that will be done, you know, on average once every 6 months. So it is a continuing treatment. It has a few side effects. The procedure itself is fairly minimal. You know, it takes about 10 minutes. Some risk for, you know, blood in the urine or infection, but the one to mention is that in a few patients it can work a little bit too well, and they may actually have some difficulties emptying the bladder. So something to consider. You know, you have to pick the right patient, or that treatment has to sound right to you. So the next step or next kind of treatment on the list is the posterior tibial nerve stimulation. So the posterior tibial nerve is something that runs down the inside of your thigh, and it connects more centrally with the nerves that supply the bladder. So this is a type of treatment that is going to send an electrical signal through the nerves that control the bladder to kind of modulate some of those abnormal signals that we talked about early between the brain and the bladder. This is done through a little needle in the ankle. It's a little bit like an acupuncture needle. You can see in the picture right there. That's going to be connected to a generator box, basically sending that signal through the nerve. It's about a 30-minute treatment done in the office. It does require a little bit of a time commitment because it's done in weekly sessions for about 12 weeks as the induction phase. And then after that, the maintenance treatments would be once every month or every other month for some patients. So if if you're working downtown and you're right next door and you can stop by on your lunch break, it may make sense. If it's a long drive or you can't make those visits in, that may not be the best treatment for you. It is probably the least invasive option. There's no procedures, no surgery, just that little needle once a week. So the sacral neuromodulation is the more permanent version of posterior tibial nerve stimulation. So it's the same concept. You're sending an electrical signal through the nerves that supply the bladder. In this case, it's more central. You're getting right at the nerve as it exits from the spinal cord in your back here. So in the sacrum, kind of low down by your tailbone, there's some little openings and the nerve comes through there. So the lead is right under the skin, sitting next to that nerve, and it's an implanted device, which means once you've got it in, you don't have to keep coming back for treatments. You have the ability to turn it up and down, turn it on and off if you need to. So it can be a more long-term option for some patients because it's not something that they have to have regular maintenance on. It's more of a set it and forget it kind of treatment. Generally done through a test phase before we do the implant. So you'll have a couple different options for the way you do the test. It may be a little temporary lead that's put in like a needle, kind of like an IV needle size in your back that's left for a week so that you can connect it to an external generator and try it at home and see what it's like. At the end of that week, we take that temporary lead out in clinic and decide if it worked or not. Another way to do the test is with a sort of called a stage test, where you put the actual lead in, connect it to a temporary generator, so you can have a little bit more time to try it out. There's a couple different reasons to choose, percutaneous versus staged option. Those are things we could talk about, which one makes more sense for you. You definitely have an option to do it either way. So let's say we've done the test and it was a really positive test. You got a lot of benefit and you're happy with the treatment. Then the next stage would be the full implantation. So it's a tiny lead, as we said, near the back, and then the generator is, probably about the size of a $50, even a little bit smaller, and it's right under the skin on the outer part of your buttocks. So it's, not something that anyone is going to see. It's not something you're really going to notice unless you really feel for it. It's very discreet. You have a remote that you can use to control it. So it's a very convenient type of therapy. There are rechargeable and non-rechargeable options. The non-rechargeable, the battery life right now is really terrific, 10 to 15 years, I think. If you feel like you don't ever want to have to potentially have a battery change, you have a rechargeable option that will probably last you as long as you need it. So, as we said, there's a couple different ways to do the test. I think we talked about this already. Maybe I skipped a little bit, but the little lead, you can see this gentleman has a little pouch on that strap on his back, and that's holding the temporary generator part of the test. So it's very discreet. It's not like you're going to be stuck at home for a week or 2 weeks while you're doing the test. And then during that test phase, you're doing some bladder diary, tracking your symptoms and kind of deciding if it works for you. So, as we said, it can be a really nice option. 84% of people have satisfaction with significant improvements in quality of life, definitely as compared to medication, since it is not something you have to do every day and tends to be very effective in the people that have gone on for the full implant. At 5 years, over 80% of people are still seeing the same results, which is not something you can say with medications, and maybe not even with Botox. Many people in the world have done the InterStim. It's been around for a long time. When I talk about this to patients in clinic, they kind of look at me like I've got 3 heads, because this is, an implant for my bladder. This is kind of crazy, but actually it's been around for a long time and has a very good track record. So, is this right for you? This is, when you're treating overactive bladder, you definitely have a few steps to get through. You definitely want to try the lifestyle modifications. You definitely want to try medications, partially because we generally like to move in a less invasive to more invasive kind of manner. Some of this is insurance as well. They're going to want you to have failed some conservative treatments. But if you have tried medications before and they weren't effective for you, you tried caffeine cessation, it wasn't effective, and you're still having bothersome symptoms, that's when you move on towards other therapies. And there are things that some providers maybe don't talk about because they don't have the experience, or maybe you've only seen your primary care doctor and never seen a urologist and you didn't know there were other options, but there are definitely other options. So if that's you, then definitely, seek out someone who has more options for you. A lot of patients have told me that they wish they had done this earlier. They've gone without pads. They're sleeping all night. They're taking road trips that they weren't able to take before. And so it's been very satisfying to offer this treatment. So I think there's a couple of the most frequently asked questions, but if there's something else that you wanted to hear about or something that you didn't understand, happy to answer questions.
Thank you, Dr. Hood. Yeah, like we said in the beginning, if you have questions, and I see a couple popping into the Q&A section, just tap down at the bottom of your screen on Q&A, and you should be able to enter the question that you have, and then it'll be anonymous, but we will read off those questions and have Dr. Hood answer them. So I'll give everybody a minute to find that Q&A feature and ask questions as they have them. I think it's really important to kind of go back and see, Dr. Hood obviously treats, I think one thing that's kind of special about what she does is she treats patients all the way through the continuum. She doesn't have, a stopping point. She offers all the available treatments that are out there and available. And I think oftentimes what we see over the years is maybe, as she mentioned, if you've only seen your primary care doctor and they've provided or offered the medications, but haven't really had the expertise to teach you or educate you about what's beyond the medication. I think that's a real important point of what Dr. Hood has shared tonight, is that there's so much more. And I think, with someone like Dr. Hood, who treats people all the way through, if you stick with her, it's more than likely that you'll be able to find a solution that improves your quality of life, that does improve your bladder function overall. Got some questions that I'll jump to now. Dr. Hood, if you want to back up one slide so you can put some of this information here on the screen. So, before you sign off tonight, if you want to take down the number here for Dr. Hood, if you'd like to make an appointment, if you'd like to research on your own on Dr. Google, we actually would encourage you to get onto the medtronic.com, the Bladder Specialist, and the Bladder Relief websites. It really gives you the most kind of robust information and a little more in depth about what the procedures are and what the available treatments options are. So, all right. I will jump to the first question. It says, Dr. Hood, what causes nighttime frequency when it's not a problem during the daytime activities?
Well, there's a couple different reasons, I think. For some people, it could be that you have a little bit of mild kind of overactive bladder tendency. So you can hold urine for, 1 to 2 hours. And during the day, it's not a problem